Welcome to the first activity of Module 1. Here, we will get a general background on what we mean by infections such as COVID-19, its transmission, and infection prevention and control, or IPC. Let's talk about infections first. Here are some basic information on infection. An infection occurs when germs such as bacteria or viruses enter the body, increase in number, and cause a reaction of the body. We most often notice this by getting ill. There are three things that are necessary for an infection to occur. Number one is the source. These are places where infectious agents such as germs live, like sinks, surfaces, human skin. Number two, a susceptible person, that is the person getting ill, which means that they are not vaccinated or immune to the germs, and a way for the germs to enter the body. Number three, transmission. A way germs are moved from the source to the susceptible person. Germs can be transmitted in a variety of ways, such as contact by touch if proper hand hygiene or disinfection is not carried out, spray splashes, for example, through coughing or sneezing when droplets carrying germs land on the susceptible person or surfaces the person later touch, or inhalation when tiny germs move through the air and are inhaled by the susceptible person. One infection that has affected our lives in a massive way is COVID-19, coronaviruses, which caused the global COVID-19 SARS-CoV-2 pandemic in early 2020, are examples of viral respiratory diseases affecting our lungs and our breathing. The people most at risk for severe or even life-threatening symptoms include older people and people with other medical conditions such as diabetes, heart, or lung disease. Let's outline COVID-19 signs and symptoms. It is important to be vigilant for any symptoms of common infectious diseases such as COVID-19 among school personnel and students. Here, you see the most common symptoms for a person infected with COVID-19. The key symptoms to look out for are fever, cough, colds, and or runny nose, conjunctivitis, fatigue, tiredness, loss of appetite, smell and or taste, nausea, diarrhea, headache, sore throat, aches, pains, and or rashes. Some diseases are seasonal, like the common cold or the flu, usually happening in the rainy season or the cold season. Other diseases such as COVID-19 are pandemics and affect the whole world altogether for a period of time, but then more or less wind down when appropriate health and safety measures are in place. It is important to be especially vigilant of the symptoms of those diseases which are most likely to affect students and teachers at the moment. If you are infected by COVID-19, it is easy to transmit it to others, thus potentially making them ill by coughing and sneezing and releasing droplets carrying the virus and touching surfaces. Other people can then get the virus by touching the same surfaces or by breathing in the droplets. The coronavirus lives in people's throats and mouths. When someone who is infected coughs or sneezes or breathes out, the virus comes out of their nose and mouth and can float through the air in tiny droplets of water. It's easy to get the virus from inside your body on your hands when you touch your nose or your mouth. If the person with the coronavirus on their hands uses a door, the invisible virus can stay on the handle for hours, which may spread to other people coming in contact with the door handle. If the virus gets inside your body, they can use your body to make more viruses and this can make you ill. The coronavirus will take usually 3 to 5 days that you feel the symptoms. This is very fast. There are other diseases where the time to feel disease can take a couple of weeks. A useful way to remember scenarios which result in higher risk for COVID-19 are the 3 Cs. First, closed spaces with poor ventilation. Second, conversations close together. And third, crowded areas with lots of people. This also means that we can understand what we need to do to avoid COVID-19 and other respiratory infections in general. Open spaces with good ventilation, distancing from other people, and wearing masks to mitigate risk of transmission. Now, let's look into infection prevention and control. According to the World Health Organization, infection prevention and control, or IPC, is a practical evidence-based approach with the aim to prevent harm from avoidable infections. In the context of schools and learning settings, IPC includes measures that can contribute to limit the exposure to the disease and reduce the probability of its transmission amongst pupils, students, teachers, and other school staff. It is important to bear in mind that preventive measures in school alone will not stop the disease from spreading, but increased vigilance and hygiene can at least contribute to reducing its spread. IPC measures are important both when schools are preparing for reopening and have resumed operations. A conducive environment is also a necessity for IPC. In particular, if water, sanitation, and hygiene services are stopped, many IPC measures cannot be implemented. Hence, it is important to ensure that WASH is in place in schools. So IPC is practically putting measures in place to prevent people from getting ill. You will learn much more about this in the rest of this course, but remember that it is closely connected to ensuring proper hygiene and safety measures, many of which you will be familiar with in the frame of the Philippines' response to the COVID-19 pandemic and specifically DepEd's response. One of DepEd's campaigns for IPC to combat COVID-19 in particular is the Hands, Face, Surface campaign. Let's watch the jingle and take note of the measures. We will tackle this further in this course.
Hands, face, space, surface. Hands, face, space, surface. Hands, face, space, surface. Ito ang paraan para labanan ng COVID. Hand, magugas ng kamay pagkatapos umubo. Face, suotin ng mask para maupadilang protektado. Space, physical distancing. Surface, mga bagay ay disinfect para sigurado. Hand, magugas ng kamay pagkatapos magbanyo. Face, suotin ng mask para di makalusot ang COVID-19. Face, physical distancing. Surface, mga bagay ay disinfect para sigurado. Hands, face, space, surface. Hands, face, space, surface. Hands, face, space, surface. Ito ang paraan para labanan ng COVID.
Thank you for watching this narrated slideshow. We hope that you now have increased knowledge of the role of IPC in reducing the spread of diseases such as the coronavirus. On the next page of the course, you will be able to watch a video which will teach you more about why IPC is important. If you're interested to read more about the information you have seen in this video, you'll be able to do so towards the end of this module, where you have gathered some recommended readings and links for you to click if you want to. Thank you very much.